If you're between the ages of 10 and 15 and have knee pain here, then this video will teach you techniques to reduce your pain and manage this common condition. Here are the key topics and techniques that we're going to cover in this video. While you're growing, the growth plates at the end of your long bones, such as the growth plate at the top of your tibia here, is still soft. And at this point, a tendon attaches, which is attached through your kneecap to your powerful quadricep muscles. So when you're using your strong thigh muscles, that pulls on the tendon and pulls on this soft growth plate. And that is how the problem of Osgood Schlatters arises. It causes pain and can also cause the growth of a lump at this point as well. You don't always have to have the lump that's associated with Osgood Schlatters, but if people do have that lump or have it into adulthood, it often indicates that they may have had Osgood Schlatters in childhood. Osgood Schlatters is a common cause of knee pain if you're between 10 and 15 years old and do lots of running and jumping. The pain sometimes reduces after sport, only to return after a short rest. Going down steps also places excess stress on the front of the knee and can aggravate the symptoms of Osgood Schlatters. So if you believe you have this condition, here are 2 bits of good news that I can share with you right now. You may have seen Osgood Schlatters referred to as a disease. Well, it's not a disease, it's not going to pass on to anybody, it's not contagious, and it's probably not going to trouble you into adulthood either. And another piece of good news is that you will recover and your knee pain will reduce as you get older. And this is because the soft growth plates at the end of your bones will harden as you become an adult. Here's the first self-treatment routine you can do to reduce your knee pain. This is self-massage using a massage stick. If you don't have one of these, don't worry, just use a rolling pin. Massage from the hip to the knee, slowly with moderate pressure, massaging on the outside of your thigh, over the center of your thigh, and over the inside of your thigh. Repeating this for 2 to 3 minutes. You can also try some taping. With the knee bent to 90 degrees, take some kinesiology tape, here I'm using rock tape, tear away the backing paper, and then lightly stretch the tape directly over the front of the knee. Rub the tape to secure it in place. Then take a shorter piece of tape, tear away the backing paper, and this time you're going to apply the tape across the knee with a firmer stretch, going directly over that painful area at the top of the shin. So make sure that if you're doing it yourself, you locate where that is, or if you're doing it for your child, make sure that you know where the painful point is at the top of the shin. Take the tape, apply this time a firmer stretch, stick it down, and then release so that there's no stretch on the 2 ends of the tape, and only this part of the tape is stretched. Rub the tape to secure it in place, and that's your simple application for Osgood Schlatters. Many of my patients with Osgood Schlatters have also reported reduced knee pain from using patella tendon straps, which go around the knee below the patella. I'll show a picture of those on the screen here, and there's more information on the taping and the patella tendon strap products in the description below this video. Before we move on, one extra tip: a few minutes of ice over this painful point may also help to reduce the symptoms. Many people with Osgood Schlatters report having tension in their thigh muscles, and it's very easy to stretch those muscles, and this can often lead to some pain relief from those painful points below your kneecaps. You can stretch like this, lying on your side. You can do the same stretch like this. This is a better position if you're struggling with your balance. This is my favorite stretch using a stretching strap. If you don't have a stretching strap, you could use a piece of rope or even borrow the leash from the dog. Make sure to stretch both sides when you're doing this routine. Also make sure you stretch your hamstrings and also your calf muscles with some ankle stretching like this. Hold each stretch for 10 seconds, but if you find it helps or feels relieving or reduces your pain, then go ahead and hold the stretch for longer. Do not just ignore your knee pain and try to continue with your sports. It will likely make your knee pain worse, and it may increase the risk of it troubling you into adulthood. Although this is rare for it to trouble you into adulthood, it is the most severe and poorly managed cases which often end up troubling people into adulthood. And the next important point is don't rely on pain medication. This can do more harm than good. Always consult a medical professional before taking any pain medication. So I'm now going to tell you the 3 most important strategies that you can do to help manage your Osgood Schlatters and reduce your knee pain. Strategy number 1, reduce the painful activities by 50%. So if you're training twice a week, then simply reduce that down to once a week. And this will allow some capacity for recovery and reduction in the pain. This approach is very much preferred over what many doctors often prescribe, which is a total rest period of many weeks, which can be rather difficult and devastating for young athletes. Strategy number 2, prioritize. Prioritize the important training and events. Don't try to do everything. So if you're playing for your school, for the local village, and perhaps for another team, just prioritize the important training and events that you want to do, rather than trying to do everything. Again, this will allow some capacity for recovery and should hopefully lead to some pain relief. And finally, strategy number 3, switch to alternative activities that are non-impact. So if it's the running and jumping which is aggravating your knees, switch to low impact activities like swimming, walking, rowing, or cycling, for example. If your knee pain does not reduce following these strategies, then you may need to reduce the activity levels further. And of course, I would advise getting a personal medical assessment. You'll find some more helpful information and links in the description below, and I've also put some notes in there on weight training with Osgood Schlatters. If you know anybody else with this condition, then please forward this video on to them. Thanks for watching. You may wish to check out my YouTube channel where there's hundreds of other helpful physiotherapy videos. As for now, we'll see you in the next video.